Dr. Stewart here. I want to show everybody, we're going to do an ingrown toenail procedure. Ingrown toenails are the most common things that we see in the office for toenail conditions. And it's a very common problem in adults, children, and a lot of people get extremely anxious from this procedure. And usually what we tell patients is the anxiety is a lot worse than the procedure itself. And the hardest part is getting people numb because they're just very anxious about the needle. And a nice patient has agreed to allow us to show how we do this. So come over here, and I want to show you, this is an ingrown nail. This nail corner is digging into the skin. I'm not going to push hard because it's very tender. And what we're going to do today is we're going to numb up his toe. We numb the toe back here at the base. I'm going to clean it with some rubbing alcohol first, okay? And we always tell our patients what we're doing ahead of time. So we're cleaning your toe with some rubbing alcohol. We're getting these spots nice and clean. We're going to go around the toe. And then we're going to inject him with some local anesthesia. This has what's called lidocaine, 1% lidocaine, and we use something called 0.5% marcaine. And lidocaine is short acting, marcaine is long acting. We're going to numb this whole toe so we can remove this corner. So I'm going to take some ethyl chloride, and that's some cold spray. And what this does is it numbs up the skin. This is very cold, and we're going to just really, really numb up that skin. And we're going to tell him exactly what we're doing. So you should feel a lot of cold sensation on your toe here. And then we're going to get this nice and cold. Feeling that coldness?
Oh, yeah.
All right. And we're going to hit him with a little pinch and burn. So we're going to pinch and burn. And we're going to just hit the skin here, pinch and burn. We ask our patients to try and stay still. That's uncomfortable. A little pinching and pinching and pinching and burning. We try to go, not too fast, not too slow. We don't want to jab or anything. And then we're going to redirect our needle down. So this is numbing the top of the toe. We're going to come from the side here, little pinch. And as we go down, we're going to give a little more pressure, okay, to the bottom of the toe. Okay, sorry. Obviously, we don't want to induce pain, but trust me, this is a lot worse to do without anesthesia. This is a torture technique, so we do not want to torture patients. We're going to give a little more under here. The bottom usually is a little more uncomfortable. A little pinch, sorry. We're coming around the bottom, and as we go on the bottom, these bottom nerves can be very uncomfortable if they're not numbed up appropriately. And then we're going to give a little more on the top right here. We're going to go right on the side. And that's it. Did okay? Yep. Not too bad?
Nope.
And we're going to rub this in, make sure that we massage the tissues so that this gets nice and numb. And then we're going to come back and do the procedure. We always tell our patients when we're doing this procedure, it should feel like pushing on your foot. Pressure and pain are two different sensations. Some people feel pressure and it's not pain. When you have pain, you're pushing the instrument in, you take it away, and they still feel stuff. If you have pressure, you take the instrument, you push it in, they feel something, you take the instrument, it goes away, that's pressure. So the worst thing patients will feel is pressure, and that's it. Thank you.